and also in terms of breastfeeding. So without any further ado, we start with our questions for the day. I know that summers are approaching and we are having a very good time at home. But at the same time, things become a little difficult for us to understand onto why we are not able to, face the heat, or the babies have a lot of problem. And also we are enough understanding that summers could be a little difficult for all of us. So we start with the questions for today, which we have the first one as my baby is 5 months old and they are having rashes. So how do I take care? So can you please help me with the same? So now for a 5 month old, it sometimes becomes very difficult for taking care for the skin, and also at a point it becomes difficult in understanding, that it's not easy. Okay, so you need to keep sponging your child, and you need to take a cotton cloth and keep wiping the skin on the neck, on the back side, over here under the ears, because sweat accumulation is something which causes the rashes. We do not use any prickly heat powder, we do not use any oils at this point of time, because the child's skin is very soft, very delicate, and very subtle. So we have to always understand that we use sponging as one of the methods. We do not use any extra oil, because that will sometimes give a lot of pore clogging, and that would cause a lot of infection. And this is how we can treat the child who is having a lot of rashes. The rashes will come down maybe in a week's time, but give the child its own time to settle. Do not be in a hurry. I hope this has helped you. The next question which I'm going to take is that I have my periods and my breast milk has reduced. So, is there any connection? Wow, this is a nice question. But I would like to tell you that this mother has not defined the age of the child. So, probably we can assume that the child is between 4 to 6 months of age. And at this point of time, if your breastfeeding has reduced, it could be due to the hormonal differences. But this is a passing phase. So definitely the milk supply will become much better, and it and your baby will be able to feed well, in order to understand that the milk intake has also gradually increased. Now what happens over here when your periods start coming? They might come at a regular interval, or they might be having like a 2 months gap. So this is quite normal post delivery, and this is all due to the hormones. So we have to be very very careful in our feeding not being let down. Okay, the baby has to be latched well, the baby has to be positioned well, and also the baby has to be in a very nice manner. He has to be feeding frequently. So this is what is going to help us to help the baby come, and definitely your periods will be taken up regularly. Now I have another question, that how to take care of preterm babies. Now sometimes, what do you mean by preterm? Now the normal delivery is generally at 38th week till 39th week, okay? But some mothers deliver in the 7th month, in the 8th month. That is termed as a preterm delivery. And taking care of preterm delivery sometimes becomes very, very challenging, because the baby's growth is still yet to be attained. The baby's weight is not very sufficient to support the body, and also the baby is having a little trouble with the breathing, and also to survive on its own. If the baby is kept in the NICU, then definitely there are doctors to look after, but the mother has to constantly uh, give her time, go in and out to the hospital to support the baby, to encourage to the baby, to talk to the baby. This is one thing. Second thing, we are understanding that when the child is in NICU, we also have to give continuous feeding to the child. We have to understand that formula is not something which is going to work for the child's health. So ensure that you feed your child your own feed, and this is definitely going to help, because when we are doing feeding giving our own milk, expressed milk, it is going to benefit the child's health, and the weight gain is going to happen, and the child is going to be out of the hospital very soon. So this is one advantage. Second advantage is the baby's weight gain starts on an effective manner. So definitely, gradually, over a period of time, the baby's normal functioning starts taking place, and the family is very happy that the baby is with them. Other routine of injections, of vaccines, of regular checkup are followed as per the guidelines given by the doctor. So this is how we have to take care of our preterm. Our next question is, मेरा बेबी ने 2 बार उल्टी कर दी है, दही जैसे बहुत ज़्यादा क्वांटिटी में है, इसका क्या रीज़न हो सकता है? वो 5 महीने का है। ऐसा होने का एक ही कारण है कि वो ऐसा होने का एक ही कारण हो सकता है कि आपका बेबी का ओवर फीडिंग हो गया है और जिसके कारण उल्टी हो गई है। सो वी हैव टू अंडरस्टैंड दैट दिस इज़ अ वेरी कॉमन प्रॉब्लम, बट बर्पिंग इज समथिंग जो हमको करने का है, जहाँ पे बेबी को उठा के इस सर यहाँ पे रख के पीठ के बल ऐसे उसको मसलना है, जिसके कारण वो बेबी शांत हो जाएगा और उसकी उल्टियाँ नहीं हो पाएंगी। दूसरी बात है, एक उल्टी होने के बाद दूसरी दूसरा फीडिंग में थोड़ा टाइम होना चाहिए। So it is helpful for the mother to understand there is equidistant time and it is all good for her child. Our next question for the day is, I am a mother of a 3-year-old boy. I am hoping to get some solution. During my pregnancy, I have lost around 13 kilos of weight and had gestational diabetes. My baby was born around 2.8. Now he is not gaining weight properly, so the doctor described him 3 to 4 feeds of formula per day. Right from the beginning, whenever I'm trying to breastfeed, he sleeps off. And we do tickle, मतलब ऐसे करते हैं to wake him up. Since we started formula, he is okay with breastfeeding. I have started exclusively pumping and I get around 70 to 75 ml of milk per day. So this is quite good. I am a vegetarian and I do not like eating non-veg. Will I be able to increase my milk secretion? It's been 3.5 months. Will I be able to breastfeed my baby again? After bottle feeding has started, he just doesn't want to breastfeed. He just cries out loud. I feel very stressed and I feel that I will never be able to see his smile. So please help me. Okay, now the mom has given so many details that she is breastfeeding, she is giving formula 3 to 4 times. The baby is 3.5 months old, but bottle feeding has confused the baby between normal direct breastfeeding and bottle feeding. So definitely, to the mother, that breastfeeding can be taken over. Improving your diet will definitely help you to improving the output. Your output is quite sufficient, but in case you feel that the output is still less, you can increase it more. Third thing is, the bottle feeding part of it has to be removed completely. Now when you are giving the formula, introduce with a spoon and a katuri, because this is very very necessary. As the speed of the feeding slows down, the baby understands between suckling and sucking. So the baby can be brought to breast. It requires a lot of patience, but it will happen over a period of time. And definitely, you will be able to see your uh, baby's smiling, happy face, because the baby always feels very, very happy when he or she is with his mom. So I believe that all these steps, once you follow, will definitely help you to calm your stress hormones. And once your stress hormones are reduced, they are going to work beautifully for your health. The next question is, please, anybody can suggest me that I am getting my periods late after delivery. Though my delivery happened last year, but my milk production is quite good. I am still not understanding what is the case. Over here, the scenario is very different. Periods are coming late, and she's still worried that they are irregular. So as I explained earlier also, that periods could be irregular because of the hormonal changes happening in the body, and this is going to cause an effect onto the breastfeeding. If you're breastfeeding the child on time, if you are able to feed your child properly, then definitely need not worry onto all these aspects. Feeding can continue, and your hormone, probably it could so happen that your periods may not be regular till 1 year of age, 1 year post delivery, or 1.5 years post delivery. This is quite very common because of the hormones. And if you feel so that you want to have regularized periods, if your child is around 8 months, 9 months, you can start with a good amount of exercise which will help you to be in shape, which will help you to get back to your routine, which will help you to have a concrete understanding of yourself. And that will be all. I hope this helps you. Okay, so we have our next question over here. Suggest me um, something for my back pain, since I'm suffering from last 3 days. So over here, I would just like to tell you that back pain could be common, and it could be due to a muscle pull or lifting up heavy weights or something which we do not really think for. It could also be a twitch in your muscles. So looking forward for uh, you know for a back pain relief, it could be that you could do a hot compression using a hot water bag, put some ointment, do not lift any heavy weights, and do not have any forward bendings. This is how it will be very helpful. Our next question for the day is that, what can I do for my child who is coughing for 2 days and is now at the age of 2 months? So this would likely happen to your child because cough could happen due to the sucking or the swallowing problem. Swallowing could be a problem. Air could be going inside, and the child's mouth, the oral cavity will be very small. So it will be very difficult for the child to take in large quantities of milk. At a given point of time, if the feeding of the child is very continuous, then coughing would be an obstruction and the child would throw out the milk. So, in this, I would just suggest that wait for the child to take sufficient amount of milk. Help the child to get a break in feeding, and that would reduce the coughing during feeding. Burp the child well, and this will eventually help you to put the child's lungs at rest. See, this cavity being small, it becomes very difficult for the child to take in in large quantities, and if you have oversupply, it becomes more difficult. So you need to slow down onto the pace of the child's feeding, and this is what I feel will help the child to be going much better. I'm taking up the last question for the day. Um, I have too much of itchiness on my legs and hands, sole of the feet and palms of the hand. and my doctor has done the blood test and everything is normal. My hemoglobin is also exceptional, which is 16. What should I do? Well, this is a very tricky question. You feel itchiness on the hands, palms, legs. This is all due to sweat. I would just help you out over here, that help yourself with a lot of hydration, drink a lot of water. Also believe that you will be able to do things well when you are talking about, taking forward, looking forward for comforting yourself with a lot of cold things. Like you can use ice, you can put your feet in cold water, which will reduce your internal heat and your itchiness and sweatiness gets reduced. These are some very local and used techniques, and it becomes easy for you to understand that things would be better in your way. And I hope you have understood the questions that I have taken. I will be coming up live Monday to Friday from 10:30 to 11, and you can ask me any questions of your choice, because that will help me to understand what are the problems you are facing. I am available on with the Baby Chakra portal, and definitely it is going to be very worthy to guide you in a way, in a lot manner. Thank you. Have a blissful day.